1 FM and AM 1160. And our conversation this morning with Chris Koren and Jim Kinneer is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Well, Chris comes to us from IUP. Jim from the Indiana Regional Medical Center. It's good to have you both with us. Good morning.
Good morning.
Morning.
It's great to be here.
It's good to have you both here with us today, and it's good that you're both together in the same room because you are spending some time together lately with the Rural Health Pulse podcast, which is a collaborative effort of IUP and the Indiana Regional Medical Center. Jim, how did it all get started?
Well, actually, Chris was the visionary that had the idea of how to do a podcast. So I think she would be a great person to explain her inspiration for doing this.
All right, Chris, explain yourself.
All right. Thanks, Jim. It's been a fun collaboration. We saw some opportunity around the National Rural Healthcare Day. We thought we've been working so nicely with Indiana Regional Medical Center, and we thought what would be a good way to find out and identify a platform where we could tell stories about our rural healthcare work together. And that includes about our academic programs, our research collaboration, and new initiatives that are in this area that are helping our community.
Yeah, and the vision is pretty long-term, isn't it?
Yes, it is.
Yeah.
This all fits into how we see our two entities working together.
Mm-hmm. So you've got a season in the books. Mm-hmm. Have we seen all of the episodes yet?
No. We have we have 10 episodes for season 1 already recorded and set, and we really wanted to give a big shout out to our communication media academic department out of the College of Ed at IUP, because they really helped with all the technical aspects. Mm-hmm. And the season set, but we release the episodes 1 per month. So Jim can share a little bit about maybe the history of what's been released already and what to look forward to.
All right.
Sure. Well, we kicked off the podcast in November on National Rural Health Day, and our first guest was Dr. Amanda Valia, who talked about the residency program at IRMC and how that was established. And it was a great way to kick off the program because that really part of the residency program is that rural health identity and how to attract physicians to a rural community. Our next podcast in December, we had an opportunity to talk to Jackie Sanzik, who's the administrative director of the laboratory at IRMC, and Dr. Barathon, an IUP professor. And we focused on the partnership between IUP and IRMC for COVID testing. Uh-huh. And it was just fascinating to hear the story, in particular, Dr. Barathon speaking with his enthusiasm and energy of how all these connections came together to bring the testing solutions together during the height of the pandemic. And this month, we're getting ready to release our 3rd episode, and it's going to focus on the wastewater testing initiatives that occurred for Indiana Borough and the surrounding areas. Mm-hmm. Also, part of that COVID response and how a partnership was formed between IUP and IRMC and the borough to use some of that information to kind of build predictive models around where we were at in terms of phases of the COVID pandemic. So what's been really great is there's just so many great stories out there and so many interesting things around us. Being able to sit down with people and capture that and hear a little bit more about it.
Yeah. In terms of length of each episode, are you limited by any means?
In general, we're trying to keep the episodes less than 20 minutes.
Mm-hmm.
I would say we typically have been in maybe the 15 to 17 minute time range. So we don't want to have the episodes too long that it's difficult for people to access them or be able to hear them. But we also want to have enough content that it's meaningful as well. And it seemed like it's been a good balance.
Yeah. Well, when you think of subject matter and when you're talking the rural health, we had a doctor on from Dallas a couple of days ago talking about a doctor shortage across the nation, and certainly the residency program came up that we were talking about with him. It really is something that you can see this podcast being, it's something that really takes hold because people will get an opportunity to really get inside the entire issue. You can do a lot in 20 minutes, can't you?
Mm-hmm. Absolutely.
Yeah. And so that was one that interested me. And the second episode as well, because that was a pretty exciting thing when it was first announced in the middle of the COVID pandemic. That seemed like one of those, here comes somebody riding the horse, to the rescue. And IUP really stepped up there. Chris, I know that from the standpoint of IUP and its involvement with IRMC, that really is an exemplar of what the partnership and the collaboration can be.
And it spreads right into episode 3 with, Dr. Adkins talking about those, what Jim shared, the borough, the hospital, and IUP all working together, in support of understanding how we inform our community when there's a pandemic. How do we prepare with using each other and really sharing resources? Because we have to be a lot more savvy, because lifespan shouldn't be dictated by zip code. And our rural areas certainly have big gaps, but we can drive solutions by working together. So we're excited about that. And the collaboration, we see some potential growth with testing wastewater samples and utilizing the hospital and the university, again with Roland Francis at the borough, with maybe entering into the space of opiate abuse, using wastewater to kind of see where our analysis is about how our rural communities have been impacted by a lot of opiate abuse. So, and that's just one illustration of what could happen with already what we've done before. So we look to see season 2 about how the wastewater research is going to expand.
Yeah, the technology end of it, and the fact that it is so accessible to us in a rural setting that we find ourselves, as opposed to some other more urban setting, more metropolitan setting, is interesting to me as well, especially with the news that Indiana County is really stepping forward with its broadband initiative, and the accessibility of your podcast to not only this community here, but to all of Indiana County and extended beyond. The potential just seems limitless.
I think there's a lot of new areas for us to explore, a lot of new areas to tap into. And I think one of the great things about the podcast is we want to capture some of the good work that's already been done, but we also want to see it be a catalyst for new ideas, new partnerships to kind of really start some of those conversations occurring. And that's really been a big part of the partnership as we've continued to build on the testing collaboration that we had, is how do we get people from, the university and the medical center together? How do we get the right people talking about things that we can be doing together, what each other is working on? And the podcast was just one of those ways that we can do that. And we want to continue to build on that.
Feedback is obviously going to be very important as well, both from IRMC standpoint and from IUP standpoint. What have you heard?
Well, so far, all good remarks, and we're going to be exploring ways that we can, solicit feedback from our networks, both from IRMC and IUP. I mean, we see a value in understanding that IUP has an alumni network of over 140,000 individuals all over Pennsylvania and the U.S. So, and beyond, really, with some of our international student population. So we see this as so valuable because we're showing them actionable things that have taken place already. And when we look to plan for season 2 and season 3, we want to say, hey, what did you like? What do you want to hear more about? And are there new topics out there that we should explore? So feedback is going to be important. And we both, Jim and I, know that that's feedback is a gift, and we can learn and grow from it.
And certainly from IRMC standpoint, beyond your own facility or regional, really, you could hear from organizations and medical entities from all over the country and the world as well.
Absolutely. So this is a great opportunity for exposure of making some of the things that we're doing known far beyond our own community and reaching out to a broader audience. And I also think in terms of feedback, what I've heard, positive feedback-wise, is that people really have enjoyed hearing those firsthand experiences and some of the insights behind what's happening. So if you, read in the newspaper, you knew there was a testing collaboration. You knew that we were doing wastewater testing. We know you have a residency program. But hearing the individuals that are directly involved, telling their story, telling what was involved, I think everyone walked away saying, oh, I knew about that, but I learned something new. And that's one of the exciting things about the podcast.
The Rural Health Pulse podcast is the name of the program. And we're talking this morning with Jim Kinneer and Chris Koren about it. They're the two hosts of the podcast. So how do people watch it?
So a couple ways you can watch it. So one of the ways you can get to it is if you go to the IRMC website. So it's irmc.org/pulse. We have a page dedicated to it there, and you can listen to it with the links there. You can find it on Spotify. IUP also has links on their website to it as well. It's actually available in an audio version, and it's also available on YouTube. So you can also do a search on YouTube and find the links to it there as well.
Yeah, it's out there. It's out there in a number of different ways that folks can watch it. It sounds like it's going to be fascinating to watch it unfold. So you've got 10 episodes from season 1 that are already in the book. You guys are cruising. I mean, Man, you can take your time with this and really get into the exploration of it, can't you?
Absolutely. And I think we learned a lot, at first, like anything, the first couple episodes were a lot of work and felt a little bit hard. And then once you start getting a pattern and you start getting it down, it becomes easier. And the ideas start coming up faster in terms of the other things that we can do. So it's really exciting. And again, another shout out to the IUP Communications Media Department, in particular, Dr. Mark Powinski. I mean, Chris and I are great idea people, and we get excited and get ideas and have the visions, but then you need someone to really help you say, okay, let's break this down, how to put this on the schedule, let's make this reality. And that's one of the many strengths of Dr. Powinski, and he's been a great part of our partnership and making this successful.
Chris, has he asked to sing the theme song yet?
Oh no, but I hope you and we can invite others, maybe even to somehow get the voices of the students who are behind this project, working directly with Dr. Powinski, because when Jim and I both have it pulls on our heartstrings when you use the workforce development phrases around here, and just think about the students and this leadership opportunity that they have because of the IUP IRMC collaboration, that they get to put these episodes together, meet these all the guest speakers, and then be able to talk about that in a resume or when they're looking what industries they want to work in, because communication media is so important. So, not only are we happy that we get to feature so many unique voices, but it's really the voices behind the scenes that are so instrumental to making this all happen. So thank you again, Dr. Powinski and the student team that are behind this.
It's interesting. Earlier this morning, we had the ICTC students in from their digital media department talking about a project that they are doing. Here we are talking about comm media and what they are doing, and how both of them really work into what the community's needs are, and how you can help to meet them. It's really neat to see collaboration. It's a good thing.
Yeah, absolutely.
So thanks so much for coming in to visit with us. We appreciate that. We look forward to the next episode, and we'll continue to watch.
Thank you for having us.
Thank you very much.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160.